I started crying when I was talking to him too. But he basically said that, you know, that there's like palliative care to hospice care and everything in between. So I just told him, you know, I just feel like I need something to take the edge off. You know, I don't know if it's, you know, and then he asked me what Kaiser told me, and I said, well, you know, they told me they didn't really talk about all the medication options, because she's kind of said she's kind of leaving it in my court to decide when, you know, and if I need to try something. And so I said, well, she mentioned something like a low dose of morphine. And he said, well, that would help you. He goes, it doesn't treat anything. He goes, but it helps your brain tell you that you're being able to breathe better. You know, so you can, you know, maybe, he said, I don't know for sure, but maybe try and do more things. Like, you know, he said, you know, I said, yeah, I can't, you know, go anywhere without a wheelchair. He said, well, I don't know if it's going to help, you know. I don't know if you're going to be, you know, doing that. I said, but even like walking to the bathroom, you know, kitchen, walking downstairs, you know, maybe you can help me just feel better. He said, well, they would probably, if they did that, start you off with a really low dose to see if it even does anything, or if, you know, if you can tolerate it. He said, but there's a lot of other medications too. And it doesn't necessarily have to be palliative care or hospice. It can be like, you know, something in between, just to make you more comfortable. So that's what I want. I just want to be more comfortable. Well, but I don't feel like I'm ready to like quite die yet.
Well, that's what they
I
obviously
asked him, I said,
agree.
well, would I stay on all my medications that I'm still on? And he's like, yeah, you know, yeah, they can.
They want you to be comfortable too. That's why they're talking about that with you. They're seeing that you're not well, like you're struggling and you're in a lot of pain and things like that. So
and it just seems like, you know, you just heard what that Dr. Chester or whatever the hell her name is, you know, I don't know what her name is, but it just seems like, you know, they're all thinking the same thing. Like, even that really nice doctor I talked to this morning, Dr. Wilkinson or whatever, you know, and I'm sure he's hearing things from Dr. Ramsey, and they're just basically saying, like, there's nothing else to try. And so if my breathing continues like this, you know, and they're giving me every possible thing they can give me and doing bronchoscopies, then, you know, there's nothing else. It's gonna get to a point where they just have to make it so I'm comfortable too, so I'm not suffering every day.
You know what I mean? I don't want you to suffer either. I don't want to see you like that. I mean, you're already suffering. You're already in pain every day at home. I mean, you're in pain every day, all day long. On top of the breathing.
You know, and I don't know if that's going to get any better. But I mean, they're giving me the same. Well, first of all, they're giving me these antibiotics for bacteria, which they're just giving me as like a.
Do you think it's helping at all?
I don't think. Well, especially if I don't have bacteria, I don't know why I'm taking.
Well, I will say that you seem a little bit more lively and a little bit more alive.
Probably because I had the bronchoscopy
from when you first got here.
Yeah, I mean, probably because
I mean, you were really bad when you got here.
Yesterday, I couldn't even.
You couldn't move.
Yeah, but then I had the bronchoscopy, and then they give me all that anesthesia. And the anesthesia, But I told them I was going to try and walk today, and I don't think I can go out and walk.
No, don't overdo it.
I might try and walk to the window, just to try and get up and say I tried to walk. But just going to the bathroom was hard, you know what I
Are they
mean?
giving you like anti-clot shots because you're laying in bed? Remember how they used to give you those?
They usually don't start giving me those until after a few days. I'm trying to move my leg so I don't get caught. I don't know what to think anymore. I'm like, oh. It's just after I talk to all these people, I think. And I do agree. It's like I've been thinking that for a long time. This shit ain't working. I mean, they're giving me everything, they're throwing everything in there but the kitchen sink. And nothing seems to be, getting
They've
better.
given you every kind of medicine.
They've given me
for
everything
fungus.
that they possibly have. And I'm sure they have everything here.
And it's not working.
She just even said it, this lady, Dr. whatever.
Mm-hmm.
She just told me, basically, yeah, we've given you everything. There's no more medications. And then he basically Dr. Wilkinson or whatever that other doctor is, he basically told me the same thing this morning.
That's when he told you about the palliative care thing?
He's the nicest doctor, I swear. But he said, and he made it sound like it's gonna get like, there's just gonna be a point where it just stops working, which I think it already has. And
What
then,
stops working, like the medicine?
yeah, like the medicine's just, they're keeping, I think, everything at bay, which is fine for now, I guess. But it's not like curing anything. I still have aspergillus after 2 years, I don't know.
Are they giving you Ambison here? So they are giving you Ambison every day here?
An Arikayce.
Or amikacin?
Yeah, amikacin. They're giving me that.
Yeah.
They're giving me the Ambison. Giving me the calcifying. It's like all panoprobazole or whatever it's called. No. Yeah. No? Yeah. No? Yeah. I don't remember what it's called. Just the antifungal medicines that they're giving me. And then she said that she doesn't think the Cresemba's going to make much of a difference. Like, they keep giving us, like, since this has started, they keep giving us all these medications with the hopes that they're going to, and then it just gets us like, okay, they're switching to the Arikayce. Well, that one's not growing anymore.
That's for Mac.
That's for Mac, and that seems to be kept at bay.
But
and all my bacteria, like he was saying this morning, that Dr. Wilkinson, he said, yeah, there's no really like bacteria that they can find.
So it's all fungal. Did he say that they found fungus in this?
Yeah, he said they were showing aspergillus and
mold,
Staphylococcus. So that's what's like.
So that's starting to spread? Is that what's going on?
I think that's why I have all the the cloudiness and stuff. That's what they're thinking, because they can't think of anything else that it, because it's. He said, basically you're not showing any bacterias, which is good, but so they're ruling out that it's more like a fungal. They're ruling out the bacteria and thinking it's more of a fungal. And then that's when I asked him, I said, could it be cancer? And he said, well, it doesn't look like cancer. But with immune suppressed patients, things are really, you don't know. Just like with the squamous cell. Squamous cell doesn't do this on normal people.
Did he say what squamous cell would look like if it got to your lungs? Like, did he talk about that at all?
No, he just said that it didn't look like it, but they would really. And I said, well, how do you find out if it is?
Probably PET scan.
And he said, well, he did say the PET scan. And I said, well, they hadn't wanted to do that yet. And he said, I don't, he said he was going to talk to Dr. Crompton. Because with the breathing as it is, he wants to talk to him about the surgery. He didn't say they wouldn't do it. But, he just has to. But he said they would have to, something about the lungs, they'd have to do a biopsy. But at this point, he said it doesn't really look like it would be, like they haven't said, oh yeah, that looks like cancer. So I don't know if they would have to, hey look, this guy, the Dominican guy, he's doing on the street now, Pedro, whatever the hell his name is. But anyway, that's a side note. And then, so I don't know. He didn't say, he said it just doesn't look like cancer. But, And then that's when I asked him, I said, well, if this cancer, there's no lymph nodes to go into, where would it go, like into the breast tissue? And he said, no. He said, well, the most likely place that that the cancer like that would go is into the armpits and the lungs. Come to think of it, I don't know how he knows all this stuff.
The doctor. Well, he's a doctor.
I know, but a lot of doctors don't know about, like if you're a pulmonary doctor, you don't really know about, look at the bears are catching salmon again.
Well, he is part of the lung transplant team, so I'm sure he's seen quite a bit of stuff. You know what I mean? Like you're probably not the first patient to
I don't know.
develop
I wonder
squamous cell and
I wonder
all
how
that
many
stuff.
people have ended up getting this like this.
I don't know, but
I mean, how many people have gotten this bronchial stenosis like this? I don't think very many.
not very many, and I don't.
Well, they say people have gotten bronchial stenosis because I've asked several doctors this, and they say a lot of people, it's people get this after lung transplants, but usually it gets sorted out. They can fix it. I just happen to be someone that they haven't been able to.
All right, it hasn't gone away.
They haven't.
But
been
you
able to,
have, it's beyond that. It's now, fungus and cancer on top of stenosis. So even if the stenosis went away, you're still dealing with other stuff, So it's.
Well, that's what
it's
he
tough.
was kind of saying this morning. He's like, you got a lot of things.
It's a lot going on. Yeah, it's a lot going on.
I've had a lot going on for a long time, but now it's just it's like snowballing into.
The snowball's getting bigger.
And I'm like trying to, I don't know. I told him, I said, I know I can't do the chemo, which I really wouldn't want to do anyway, not to be.
Well, that's not an option for you because that involves.
They wouldn't do that anyway, and I've been told that.
That would attack your lungs. That would cause lung rejection. So that's not an option for you. So it's basically radiation and surgery.
And I'm just like scared to get radiation.
Now, was the radiation doctor, was he supposed to get back to you or schedule an appointment or what was he supposed to do?
After the surgery, if,
You don't know?
Dr. Crompton's going to do the surgery.
Yeah, well, it's still scheduled for next Wednesday. Hopefully you're out of here by then.
And hopefully, this doctor said he's going to send Dr. Crompton a email.
Regarding what? Whether to
surgery,
forward?
Yeah.
Whether to go forward with the surgery?
Well, I kind of sounded like that.
I mean, you have to get that stuff out of you. How is that going to go away? It's just going to keep getting bigger.
I don't know, but with my breathing situation and my...
What, the surgery is going to cause your breathing to get worse? Is
I
that
don't
what
know,
he's saying?
that's just what he said. He said, I don't know, He said, I'm going to talk to Dr. Crompton about the surgery and see, where we stand with everything. That's basically what he was. He didn't say, like, oh, he did say something about the breathing. But I don't think that should have a.
You still have to get those staples taken out of you.
That's what he said. He goes, do you know when you're getting the staples out? And I said, well, I'm assuming they just took the drain out last week, and Dr. Crompton said he wanted to keep the. Remember?
The staples in.
When did we take those staples out? I mean, the drain out?
Like 2 weeks ago? Like a week and a half ago? I did it on Friday.
So he said he likes to keep them in.
Like 2 weeks after, to prevent swelling. And
so I was just assuming that, because they keep looking at it and everyone says it looks really good.
So you have to see
really
him anyway.
healed.
You have to see Dr. Crompton.
It was actually got swollen again today. I should be, what's the word? Elevating it?
Elevate your arm. Well, I mean, it doesn't look too swollen.
It's not, it hasn't been swollen the last couple of days, and then starting today, it just got a little swollen. So, I'm sure, and I told the doctor, I said, well, I'm sure he was planning on taking him out he'd have to take him out before the surgery, which is supposed to be on the 31st, and then that's how we got started talking about the surgery.
Well, we definitely need to see Dr. Crompton sometime soon to get those staples out.
Mm-hmm. Well,
even if he doesn't do surgery, you still got to get those staples removed.
Well, I mean, much as I don't want to have the surgery, I think I'd rather have him just try and take him out. Because we don't know if anything's spread it or not yet.
Yeah, we don't know. But the longer you keep it in there, that's not... The more opportunity it has to spread.
I feel like sometimes when I talk to Dr. Crompton that... Or at least when I talked to him when we went in the office, I got this feeling like there's something about him that's a little skeptical about doing the surgery. Do you get that feeling when you... Because he's just like, well, this isn't really how... We don't like to treat cancers with just...
Cutting it out.
Constantly cutting you. Which I'm like, well... God, I'm just like thinking like, okay, they're going to cut these things out. Then I'm really going to be in pain. And then they're going to try and do radiation on all of this. Oh, God.
Seems like they should do radiation first. Just to stop them from growing.
Well, maybe they'll do that. I don't know.
And then do surgery after that's all, cut out whatever stopped growing, all the radiation. I mean, I don't know. What do I know?
I don't know if radiation can handle these stuff. I don't know what, I think radiation is to be used after, I don't know, because usually they don't do like Sharon with hers, they said they tried the radiation and the chemo, and then if it's still showing, then they would do the surgery. But I think the surgery is like the last. But this is different because this is a skin cancer.
Well, it's like marbles in there. So, I don't think radiation is going to make those go away. I think what it does is it just stops it from growing any bigger and kills what's in it, but it doesn't, the little marbles remain. So that's what I mean, like after.
It seems weird that they wouldn't shrink down.
Remember, that's what Dr. Crompton told us that.
No, I think that
radiation doctor somebody told us that doesn't make it go away. It just kills it and stops it from growing. So it seems like that would probably.
That just seems like it's gonna hurt so bad under there.
Yeah, I'm sure it doesn't tickle.
And then that radiation is for 6 weeks every day.
6 weeks.
That's what he said. The oncologist said.
Oh, wow.
I'm like, oh.
The guy you had on the phone call, he said 6 weeks every day.
Every day.
But it's only like for a couple minutes, right? It's not like all day.
I think he said it would start off at like 10 minutes or something like that, 10 or 15 minutes. I can't remember what he said.
Start off and then.
Oh God, I don't even want to think about that. Let's not even think about that right now. He said he would have to see how everything comes back. Like, I don't even want to have this damn surgery on me. At least it's not on my lymph nodes. At least it's just on my arm. But my arm's already like had 2 surgeries on it, so it seems like my arm is just like stretched to the limit. Oh, the Dodgers are doing pretty good, I think. Yeah, it seems like it's just and then they got to go under there. I don't even know. I think there's one up here, one of those balls. Is that the lymph node?
I have no idea.
So I'm thinking, no, the lymph nodes were the...
You have a lot of bumps under there. I felt them.
Well, this is where the surgery was. But I think these right here, there's 2 lumps right here. I swear I think they're trying to get into the lymph nodes. But there's nowhere to go. It just seems like it. They might... I don't know if it's... I think when they did this surgery... Okay, because the lumps were like under here, right? And then they did the surgery and I think they pulled so much skin and tissue that when we were done with that, these had shifted. And now it just feels like they're trying to get into the lymph nodes. Like they're making their way up there, but maybe they're getting up there and then there's like no lymph nodes. How did we get into this mess? Someone out there's trying to torture the hell.
We're gonna get through this, okay?
Two and a half years of torture, but I've had some good times in between. I do like to go eat.
Yeah. I gotta get you a new cake when you get home.
I know.
I've been eating
I wish there were some good movies out. I did enjoy going to the movie.
Yeah, right now
And sitting in the comfy chair with popcorn. The
not
Elvis movie was good, Mom.
Yeah, that was a good one.
But there's not really been anything out I want to see. I'd really need the wheelchair now to go to the movie.
It's okay. You know I don't mind pushing you around in the wheelchair.
And then what if they start me on this morphine? Then I'm not ever going to be able to drive, right?
You don't
I don't
drive
know. I have
now.
to ask them. I know, but I can drive. I can drive now, my arms.
Your arm doesn't hurt.
I don't know what it's going to be like if they do this other surgery. But
Yeah, or if they do the surgery.
if they do the surgery.
And the radiation, or the radiation. I don't. We have to wait and see.
Well, they wouldn't do the well, yeah, they would. I mean, the doctor made it sound like he wants to see what the pathology is and the borders, you know, to even determine if if radiation's needed. I don't know. We just gotta wait, Mom. And then just continue going day by day. That's all we can do. Ain't brown bread yet, Monk.
No, you're not.
I still got a ways to go. I don't know how long, but...
You're still alive, Monk.
Still alive. I just need something to give me like a little bit of a relief during the day.
Well, that's what they're working on with this palliative team.
Yeah.
Hopefully they can
When I
get
talked
you
to them,
more comfortable.
I said I was hoping you were, I told the doctor, I go, well, I'm hoping my husband's here when they come, just so you can hear what they have to say.
Well, I plan on being here all day and all night,
I
so
don't know if they're coming today or tomorrow, but
I'll be here.
well, they won't come at night because they usually are probably done working at like 5 o'clock. I'll just see what they have to say. Hopefully they can give me something that at least makes me think I'm hey, who knows? Maybe if they give me a good dose of morphine, I can start doing a little Poshmarking. at least taking some photos and posting some stuff, right?
Yeah.
I could have you take some photos for me too, Mom.
Okay.
We got to get rid of some of this stuff I have.
I'll take the pictures if you need me to.
Okay. Well, I guess I kind of have to pee again.
Okay, I'll help you.
I took a little more coffee. The one thing I do like is McDonald's coffee. It's good. And this time they didn't put too much cream in it. Just no cream, but then probably the ice melted too, huh?
Yeah, it melted on the way here.
It's 12:30. I'm supposed to order lunch. I don't know if I'm that hungry from that big breakfast I had.
I should order something.
Like what?
Grilled cheese, tomato soup.
Yeah, maybe I'll do that. I had tomato soup last night because after the bronchoscopy, I thought I was going to want this big giant meal. And then, oh, I was like this. And I was just
You were out.
they finally got me the menu like around 7:10. They told me that it was the last I could order was 7:30. So I ordered, what did I order? Oh, I ordered tomato soup. And I ordered mashed potatoes with gravy. Did I order something else? I don't know. I didn't want a big meal though. And then they gave me, they gave me like a few things of graham crackers. And then that's what I ordered. And then I went for a little while until they kept coming in and bugging me. They always like to bug you. Never a peaceful moment. They stopped bugging me from about about 10 to, and then they start in again about 4 o'clock. They want to take your vital signs. Then they wanted to give me an antibiotic around 5. Then around 6 they want to take my blood for my PICC line. Then I fall asleep till about 7 something. Then they came in to introduce the other nurse. And I'm just like, yeah. And then I got this a-hole down the road yelling, Looney Tunes, calling someone assholes and this and that, and this and that. And I'm like, man, I wish I could had the energy to get up right now. I'd go punch this wackadoo. But then he stopped and then he was yelling. And then the nurse said, I said, oh God, who's this idiot that's yelling? Keeps yelling. And then he said, the mom's in the room. And I said, well, she needs to go so he stops yelling. She doesn't need to take that. And then he, when I, earlier when she came in, he was like yelling something again. And then she's like, oh, your friend, there's your friend again.
Your friend.
There's your friend again. Oh my God. I go, that's so weird. I go, I have not heard it. She goes, yeah, because you weren't in the room, right? This room. You were down the hall. So apparently he's been yelling for a while now.
Or they're used to his yelling.
I thought he was yelling at the nurses. And I was like, oh, hell no. They'd need to do a code, what is that, code gray? When they go. They need to do a code gray, and then they're just like, no. And then she said, oh no, his mom's in there. I'm like, oh man, I go, that's even worse. She must have had a cot. I said, you can stay in here all night long? And she goes, you can. He goes, she said, but there's no, like, they don't give you.
Yeah, it's 24 hour. I could sleep here if I could, but you know.
But they don't give you like a bed or anything.
No, I'd have to sleep on a chair.
So he's yelling at his poor mom to like go to sleep or something. And I'm thinking, why? Why is she even here? I guess she's like a dedicated mom. I don't know how moms
Well,
are.
you know, she knows his illness better than anyone, I suppose.
I'm dying to know who this guy is. I'd love to be able to walk around the hallway right now.
Peek in the window or the door.
Peek in the door. He's been quiet since maybe he's sleeping now. I don't know. Anyhow, I guess I should try and figure out what I'm going to order for lunch.
Okay, I'll help you.
Sounds good. Just soup?
Well, there's
Well,
I know something light, so something light would be like a little grilled cheese sandwich or something.
Their grilled cheese are heavy though.
Oh, is it?
Well, not if you get it on like a. I remember one time they put it on this thick bread. I was like, whoa, this thing's like. It is good though. It's better on.
What about just chicken noodle soup or something? If you're not really hungry.
Oh, this is breakfast, okay. We don't serve breakfast past 10. Their salads are good, but I don't think I can deal with all the mess. I had tomato soup yesterday. Maybe I will try chicken noodle. I don't want like chicken, bread, sandwich. Turkey club is like massively huge. Everything's so big. I wouldn't mind just like a beef patty with mustard and ketchup, like not a whole burger with the.
You can order that.
That's easy to eat too.
Why don't you order that?
Cut it up like a baby.
A beef patty.
I wonder if you can get cheese on it.
So just order a hamburger, a cheeseburger with no bun.
Oh, that's a good idea. And I can get a little lettuce and tomato and onion.
Mm-hmm.
And then I'll get the chicken noodle soup too. I wish I could order something for you.
I'm gonna go downstairs and get something
like a
from
regular meal.
Don't worry about me. I'll go downstairs and get something.
I'm gonna have cookies here, so I don't need to order a dessert. I think that's it.
All right. Well, I'll get the phone.
Okay.
Okay.
Yeah, that's good. burger with no bun, mustard and ketchup, chicken noodle soup, and I think that's it. And a water.